there is a group of people that do feel that we over intensify the nomenclature for, what would otherwise be considered grade 1 prostate cancer, um, um, which again is low risk and tends to be most appropriate for what's called active surveillance, which is watching it. Of those that are on active surveillance, we know that, about a quarter of them, or in some studies less than that, do ultimately go on to be upstage needing treatment. But of those patients, there is, or within that group of patients, many folks feel that we over intensify the name of that condition, and it should not be called cancer. It should be called a term. I think one of them that's thrown out there is called indolent lesion of epithelial origin. And I think the name is very specifically designed to eliminate the name cancer, so as to reduce the burden of surveillance and monitoring and treatment on those patients. I personally fall in a different camp where I do think that simply calling it what we've called it for a while, which is Gleason 6 prostate cancer or grade group 1 prostate cancer, is perfectly adequate. Why? Because once again, a group of these patients go on to be upstaged. I am of the camp that the great kind of job of the urologist and the oncologist in urology, or in prostate cancer, is to understand these buckets of people and to understand how to watch them, and to watch for progression, and to find the window where something needs to be done. And so I certainly wouldn't ever advocate treating these patients, but I think calling it cancer is appropriate because it is a cancer that can progress. And when it does, we can treat it and delay the potential side effects of the treatment until it is absolutely necessary.